No Shave November.
Hey, we are glad you are staying with us because it's what we are talking about. No Shave November. It has captured the nation's attention and funding for men's health for many years now. And joining us to discuss the impact and the momentum behind this men's health movement is Dr. Thaddeus John Bell, a family medicine physician whose work spans certainly decades, but also focuses on prevention, early detection, and mental health support for men. Dr. Bell, always good to have you in the studio with us.
Thank you very much for having me again.
So let's once again talk about what it means. You, in fact, have a beard. So, of course, this is a reminder for a lot of men about the importance of men's health and men's health awareness and preventative things that men can do. So let's talk about some of the issues that you find you have to talk to men about most often when they come into your office.
Well, I think the main thing that I have to talk to men about is getting them to understand that taking stock of their health when they are young plays a role in their longevity and their quality of life. Mm-hmm. So I try to make them aware of what some of those issues are.
Mm-hmm. And I imagine that those early screening factors are very important. What are some of the ages that men should start some of those early screenings? For women, certainly very different. What are some of those ages for things like prostate cancer health and those kinds of things?
Well, certainly prostate cancer is one of them, and I will say something about that. But I think the one that is the most important right now and causes more illness and death is just being aware of your blood pressure, making sure that your blood pressure is under control. And of course, the only way that you can do that is to get your blood pressure checked. And then if you are told that the blood pressure is high, you need to see your doctor and adhere to the recommendations. Now, you mentioned prostate cancer. Prostate cancer is in the news because it is a leading cause of death, particularly of African-American men. And so what we try to make sure that all men get a PSA annually. That means it should be gotten every year because while the test does not make the diagnosis, it's a red flag that something may be going on. And the bottom line is that if we can make the diagnosis early, the likelihood that you're going to live a good quality of life is going to be better if the diagnosis can be made early.
Dr. Bell, what you're talking about is men knowing their numbers. It's important for everyone to know their numbers, but certainly if you know your numbers, you will have somewhat of a borderline of where your health is going, the direction. You can address those issues with your physician.
That's right. Just like it's important for you to know your blood pressure number, it's important for you to know your PSA number, it's important for you to know your cholesterol number, your bad cholesterol particularly. And then, of course, the other cancers that you need to be aware of, particularly colon cancer, which is on the rise, particularly in young people, for a lot of reasons, which we don't have time to talk about now. But we do know that those numbers have changed, the ages have changed, in which surveillance should start, and that for most of us, that's age 45. And then one final thing, and having a knowledge of your family history of all of these things is very important.
For men who might not be comfortable with having these kinds of conversations, how do you ease into that and encourage someone to talk about some of these issues and certainly to speak with a physician?
Well, I think it's really important for you to have a great relationship with your primary care physician. And then what I try to do when patients come in to see me, I spend a lot of time educating them and making them aware that it's important to be around for your family, even if you don't care about yourself. Do you care about your daughter? Do you care about your son? Do you care about your wife? And sometimes I put it in that realm, then, to kind of get their attention. And then I just tell people, look, you want to live to get to be an old age. And in order to do that, you got to start paying attention to your health at an early age. And of course, with all of the young people that have been passing away at an early age, athletes included, I think people are becoming more aware of their health.
Good reminder as always. Dr. Thaddeus John Bell, we always appreciate your time.
Thank you very much.
Thank you
I
so
appreciate
much.
having the opportunity.
All right. And of course, we want you to stay right here with